Hi, everyone. My name is Valerie Stern. I'm a physician assistant specializing in dermatology. I work in Los Angeles, California, in an integrative dermatology private practice. And I'm also one of the program directors here at LearnSkin with the DCIE, or our Dermatology Clinical and Integrative Essentials program. So I'm really excited to be with you today and to go over a little bit about integrative dermatology as well as the program. So our program today is going to focus on the DCIE as well as enhancing patient care and satisfaction. So our learning objectives are going to include defining integrative medicine. We're going to examine integrative medicine's role in traditional healthcare today. And we're going to review the DCIE program and its role in enhancing patient care outcomes in specialties within and outside of dermatology. Disclosures: I have no conflicts of interest at this time. So let's get started. Integrative medicine, what does it mean? According to the NIH, or the National Institute of Health, integrated medicine, or integrative medicine as it's referred to in the United States, is a practicing of medicine in a way that selectively incorporates elements of complementary and alternative medicine into comprehensive treatment plans alongside solidly orthodox methods of diagnosis and treatment. So what does this mean? When we look at integrative medicine, we can focus on a few different aspects. If we start in the upper left corner in the blue box, we see that integrative medicine involves focusing on the person in their complexity, the more holistic approach in taking the entire person as one. Next, we move on to the purple box, and we look at the strengthening the position of the patients, emphasizing responsibility for their own health. So they're taking a key and an active role in their healthcare as well. We move on to the green box, and we see that there's also an emphasis on prevention. Our goal is to prevent. We want health literacy and a healthy lifestyle. We move down to the orange box, and an emphasis is placed on self-healing. And this includes stimulating innate self-healing abilities of the organism or the entire person. Our aqua box is where we want to build a doctor-patient or provider-patient relationship with each and every patient we encounter. And then finally, when we look at our red box, we see that we have an emphasis on a well-thought-out combination of appropriate healing practices and teamwork to find optimal treatment. So I think that sums it up quite well, that it's a combination of appropriate healing practices that we bring together in an optimal team fashion to treat each and every one of our patients in a personalized way. So complementary medicine. When we look at complementary medicine, the National Center for Complementary and Integrative Health, which is a branch of the U.S. National Institutes of Health, provides the following definition for complementary alternative medicine. And they see this as healthcare approaches that are not typically part of conventional medical care, or that might have origins outside of usual Western practice. So when we look at complementary and alternative care, you'll usually see 5 domains. And starting from the left and working our way over, the first domain is a biologically based intervention. This includes things such as chelation, dietary supplements, and specialized diets. We move on to a body-based manipulative method where acupuncture, chiropractic care, massage, and reflexology play a role. Next, we have our energy therapeutics. Again, acupuncture, things like Qigong, Reiki, Tai Chi, and therapeutic touch are part of the practice. And then mind-body practices, where we use things such as biofeedback, guided imagery, meditation, mindfulness, prayer, and relaxation techniques. And then finally, our whole medical system. And this is the whole person medical treatment from systems such as naturopathy and Ayurveda. So integrative medicine today in 2023, just a few little bits of information that might be of interest. Over 30% of adults and 12% of children seek non-conventional healthcare. These cite reasons such as safety and therapeutic options, trust in patient-provider relationships, and failure to respond using traditional medicine, all as reasons for seeking alternative care. And these numbers are continuing to grow each year. Healthcare seekers are looking for a more holistic, personalized care encompassing their entire mind and body, which includes mental, emotional, functional, spiritual, social, and community aspects of their care. Integrative healthcare includes things such as nutrition, emotional well-being, which can include things such as stress, lifestyle practices, supplements and botanicals, along with traditional Western medical practices, which takes on that whole body approach with each condition it treats. Integrative healthcare includes the functional medicine component of root cause medicine. This is where we're seeking and treating out etiology or why, as opposed to simply addressing a symptomology or placing a Band-Aid on something we see without really knowing why it's occurring. So integrative medicine's role today is healing-oriented medicine that focuses on the entire person, and again, including all aspects of lifestyle, emphasizing the therapeutic relationship between provider and patient. Integrative medicine uses evidence-based therapeutic options. Integrative medicine is a philosophy just as much as a method that emphasizes prevention over cure. So when we look at integrative medicine and we apply that to dermatology, how does that work? Well, looking at integrative dermatology, same as integrative medicine, we're going to take integrative dermatology and take on a conventional as well as a complementary medical approach. So when we look at our more conventional approaches, which is what we're taught and what most of us have come to learn over the years and have been practicing, is the allopathic, mainstream, Western or Orthodox medicine taught in medical schools. It's an evidence-based knowledge that primarily uses pharmacy, procedural, and surgical interventions as treatment. And then we add to that our more complementary approach, as we've been discussing, and that brings on the group of therapeutic and diagnostic disciplines found outside of the traditional healthcare practice. Again, this includes our therapeutic and diagnostic disciplines, as well as acupuncture, chiropractic, naturopathy, nutrition, environmental, relaxation, Ayurveda, meditation, herbal medicine, and homeopathy, to name a few. So when we look at our medical philosophies, we look at an alternative, an integrative, a conventional Western scientific model, lifestyle, and functional. And as you can see, they all have a bit of an overlap with one another. And when you get into the more integrative approaches, you can see up in this general area, we do cross over with conventional lifestyle. And of course, integrative converges with alternative and lifestyle with functional. So if we take a look at our alternative medical philosophies, these include things such as traditional and heterodox, outside the mainstream, Feldenkrais, Pilates, naturopathy, chiropractic, traditional Chinese medicine or TCM, Ayurveda, massage, ethnobotanicals, shamanism, and psychedelics. Our integrative, of course, is our mind-body medicine. We are definitely okay with conventional medicine. We use it and incorporate it every day that we practice. We also take a look at the diet. We look at herbs and supplements. Again, we look at the ethnobotanicals, traditional Chinese medicine, acupuncture, and Ayurveda. And again, going back to the conventional Western science, that's where we're looking at our diagnostics, our pharmaceuticals and procedures, as well as our research and development. And one thing it does say here is there is a bit of a skepticism toward alternatives in the conventional Western model of medicine. So this is where in our integrative approach, we do away with that skeptical look at alternatives as the conventional does, and we include all of the other approaches because they are science and research driven. Lifestyle is the next one, and again, that is integrative as well. And again, diet, nutrition, exercise, sleep, mental health, avoidance of risky substances in our relationships. And finally, functional. And again, this is our testing or our root causes. where the problem lies, how this problem developed, what triggered this situation to occur. Functional, on the other hand, is a bit hostile to conventional. I don't know if I would use the term hostile. I think what I would say is maybe conventional and functional are at opposite ends of the spectrum. And at some center area, they converge and becomes more integrative. However, functional does tend to look at things in a little bit different light than the more conventional or traditional medicine does. And functional incorporates natural supplements, condition-specific diets, mind-body medicine, and of course, things like detoxification. The US is currently facing a shortage of specialty-trained dermatologists. This is becoming more and more a problem as the years progress. And right now, I believe over the next 5, 10, 15 years, this shortage is supposed to be becoming even greater. There's many reasons for this. One of the reasons is that the US healthcare insurance plays a role in determining patient care visits in primary care versus specialty care in dermatology. Primary care being basically our gatekeeper in most of our HMO type practices and whatnot. So they are going to be the first one in line to see these patients, and it's going to be up to them to determine whether or not a patient is allowed to move on to a dermatologist or a dermatology specialist. So one statistic that I find quite interesting is the fact that skin disease is the third most common complaint encountered in primary care. So, a lack of formal dermatology education plays a significant role in properly diagnosing and treating skin disorders. And I mean, that's to be expected. They're busy in their education, their residencies, and their clinics, treating many other conditions. So they don't get the ultimate focus on dermatology as somebody specializing in dermatology would. And of course, given the fact that skin disease is the third most common complaint that they see, it's in everybody's best interest to know a little bit more about it. Specialties are going to include things such as family medicine, general medicine, internal medicine. I would also throw pediatrics, GYN, and many other specialties in this area. It's something that we see every day because everybody has skin. So we also include our naturopathic medicine fellows, our acupuncture fellow colleagues, our chiropractors, our advanced practice providers, such as myself and many of you out there, our nurse practitioners, our PAs and our RNs, as well as nutritionists and all other dermatologist healthcare providers that assess skin. Why add an integrative component to your practice? Well, patients want and seek more natural forms of therapy in many skin conditions. This is due to cost, concern over toxicity, side effects, and in many cases, patient beliefs. Patients will also come in and ask about alternative therapies when they're at office appointments. So I know in my own case, whether or not it's something that I would offer them, they may ask me about something like coconut oil, or they're applying acetic white vinegar to their skin or whatnot. So it's in my best interest as well as others to know and understand why these patients are speaking about these things, or where they have obtained their information in their approach to using these alternative therapies, so that we can speak intelligently on the subject matter, whether or not it's something that we might offer. Conventional medicine does not usually take a holistic or a root cause approach in addressing illness. A good example would be something like urticaria or hives. Other rashes may present and be treated acutely for symptoms as well. But the underlying etiology is extremely critical in curing or at least reducing the skin disorder burden. A topical steroid cream or an oral antihistamine may help. But if the environment creating the skin disorder is left unaddressed, the patient's going to continue to manifest symptoms over and over until the environmental component is treated. And unfortunately, I'm guilty of this, I have to say. And I think about the years of maybe almost injustice I feel, where I continued to bring them back. Their rash was gone. I thought, yay, we cured them, home run. only for a month or two later to have them come back. And for me, maybe to apply a stronger therapy, or we do the therapy for a longer amount of time, or we move on to a biopsy or whatnot, because maybe I wasn't looking at the whole person. And that to me was when kind of the light went off. And it's like, you know what? I need to start taking a more holistic look at this and determine things such as home environment, work situation, outside activities, and all of these things that might add to a person's underlying condition. So in my own personal practice experience, again, as I mentioned in the beginning, I work in private practice. I work in a holistic integrative dermatology clinic, which I absolutely love. I have such autonomy there, and I enjoy so very much working from both a allopathic as well as an integrative approach. And my patient population complains of things, the average things like rosacea, acne, skin rashes, psoriasis, skin laxity, hair loss, and every other condition we see basically on a daily basis. Conventional therapies never really resolved or improved a lot of these symptoms for more than a month or two in most of my patients, which led to a lot of frustrated patients. My patients were seeking alternative care because they just weren't feeling they were satisfied with the results they were getting. Also, by the time they would see me, they'd been to maybe 2, 3, 4, 5, or more private providers prior. So our goal in my practice is to optimize patient health by taking every factor into account, not just simply addressing a symptom. And we do so by incorporating a more holistic, shared decision-making, patient-centric approach to therapy. And what do I mean by that? Well, basically what I mean is that we address factors such as diet, stress, sleep habits, their GI health, any autoimmunity, illness, their environment, social and personal situations. We review chronic inflammation with patients and its effects on overall health. We discuss diet, including restrictions such as dairy, sugar, gluten, or whey when applicable. We address GI issues, which can have a huge role when somebody may be dealing with conditions such as SIBO or small intestinal bowel overgrowth. Small intestine bacteria overgrowth, and SIFO, small intestine fungal overgrowth. Their use of probiotics, stress management, and environmental challenges such as toxin exposures in the home and workplace, as well as lifestyle modifications. And I know this might seem like a lot, and you might be thinking right now, is she kidding me? How on earth do you expect me to go over all of this when I'm given 10 minutes to see these patients? Trust me, I hear you, and I'm the same. It's little by little. We start with a little bit of a dialogue, we introduce. And sometimes too, patients need to be on the same page as you are with this. Most of the time, in my case, they are. So they don't challenge me when they hear me talk about alternative therapies. However, bringing it about little by little is also a way for them to understand small amounts little by little and working together as a team. As I try to tell them, this is kind of a journey, not just a one-time experience. So basically, we're going to be getting to know one another quite well, and we're going to be working on this, from time to time, getting them optimized so that we can give them the best care for each and every situation they face. Again, our integrative approach begins with evidence-based supplements and herbs, stress reduction, toxin avoidance, as well as conventional therapies as needed. I use medications, I write prescriptions, I use tests and research and so on that we see in allopathic medicine every day. It's definitely still an integral part in my treatment plan with my patients. But I do want to try to do things such as avoid toxic preservatives in prescriptions, toxic excipients, dyes, and whatnot that can add to rashes or skin disorders in medications by using a more non-toxic compounded RX instead of maybe something that I could just write for and they could pick up at an average pharmacy. Also, improvement in skin-related conditions as well as the GI tract is seen and maintained when patients are motivated and compliant and supported by their healthcare provider. So in these shorter visit times, if you're stressing and thinking, I don't have a lot of time to go over this, touch on this. Just give them a glimpse into what this is like and let them know that you're there to support them. And then on their next visit, you're going to have some things available for them and, get their motivation up too and help them to see that they're going to, you're going to work on this journey together and give them tools that are going to help to optimize their overall health. So now let's move on to the DCIE program, our Dermatology Clinical and Integrative Essentials. The program provides comprehensive training on dermatological conditions that seamlessly combines conventional and complementary medical models into an integrative approach. The program curriculum equips practitioners with advanced knowledge that considers the entire patient from mind, body, and root cause perspectives, while increasing fundamental skill and performance, which is going to result in better patient care outcomes. And this program is amazing. It consists of 10 modules, 58 lessons, and best, you're getting 25 category 1, or I guess it's going to depend on what your licensure is, but 25 or greater units are associated with the program. So the program is designed to provide comprehensive training in dermatological conditions that combine, again, the conventional and complementary medical models into an integrative approach. And this curriculum is for providers with advanced knowledge that incorporates the entire patient, our mind, body, our root cause in treating skin conditions. The DCI program bridges the gap in dermatology education by increasing fundamental skill and performance, resulting in positive healthcare outcomes. So let's look at the modules. Fundamentals of dermatology is where we're going to start off. Next, we're going to move into atopic dermatitis and talk about things such as prurigo nodularis. Third, papulosquamous eruption. 4, adnexal disorders, including acne, rosacea, hidradenitis suppurativa. 5, pigmentary disorders. 6, hair and nails. 7, inflammatory dermatoses. This is going to include things like our bullous diseases, vasculitis, urticaria, erythema, and drug eruptions. 8, complex medical and systemic manifestations. 9, dermatology pharmacology. And 10, aesthetics and putting it all together. So when we look at these 10 modules and 58 lessons, there's a great deal of information to be had. You're going to find that in this program, it's going to suit newcomers as well as those that have been practicing for many years, including myself. I've been in dermatology for quite a lot of years now. And honestly, I enjoyed every bit of the program and learned so much throughout. So it's something that I think everybody can learn from, and it adds just a new level of education and alternative therapy to your patient practice, which gives your patients a new way of looking at things as well, which they truly appreciate in this day and age. So finally, what are our key takeaways today? Integrative dermatology in an evidence-based healthcare model that incorporates aspects of both traditional, allopathic medicine along the lifestyle, environmental, mind-body, acupuncture, herbal supplements, Ayurveda, and nutritional aspects of patient health and well-being is what we're focused on. We've got a significant number of people today seeking out and using integrative healthcare every year due to factors such as trust, safety, efficacy. These are things that they feel might be lacking in traditional medicine. Not to mention, we've got a whole group of people out there, and the internet, of course, we can't forget that are actually educating themselves, and they want to live in a more toxin-free environment. And they are much more savvy when it comes to looking things up and asking about alternative care. So we're seeing this more and more, and it's just in our best interest to learn as much about it as we can. And then third, the most common complaint addressed in general medicine involves skin. Therefore, this requires colleagues in healthcare to have the appropriate training and knowledge necessary in treating these conditions. And the DCIE program is designed to provide an overview of the most common dermatologic conditions while providing a better understanding in diagnosing and treating such conditions, both allopathic and integrative medical methods. So keep that in mind when you join this program or start studying this program. It's not strictly going to be from a complementary model or an integrative complementary model. It's going to be integrative in that we do incorporate the allopathic. We prescribe, we biopsy, we culture, we do all of the things we do in allopath. But at the same time, we look at alternative therapies where there's research-based documentation showing that these modalities work. So having the best of both worlds is something that you're going to learn about throughout the DCI program. And I think you'll truly enjoy and bring a whole new level of care to your practice and to each of the patients you treat. Thank you so much for your time. I appreciate it.